Welcome, everyone. I'm Dr. Lianov, and I'm the president and founder of the Global Positive Health Institute. And this is our GPHI podcast series on positive health and healthcare and lifestyle medicine. And today I'm delighted to have with us someone who's on our GPHI Advisory Council, Dr. Gail Ironson. She's also a professor in psychology and psychiatry at the University of Miami. She's has received 3 senior research awards, and she's been president of 3 professional organizations. So we're very honored to have you today. Welcome.
Thank you so much, Liana. Dr. Lianov. I'm happy to be here.
We're informal here.
Okay. Well, I'm very happy to be here.
Yes. So share with us how you got involved in the topic of your physician, but you gravitated to this area which really focuses on positive psychology. So I'd love to hear about that.
Well, I have gravitated toward it, and my start in this topic really started when I was born, because I have a 103-year-old mother, and her philosophy of life, she's got 2 key philosophies. The first one is every situation is going to have its advantages and disadvantages. Might as well enjoy the advantages. Of course, this ties into the positive psych aspect of gratitude. So I grew up with that. Her other philosophy that stands out prominently, she was a teacher in the New York City school system, and she was always able to get the roughest children to behave well. And so the question was, how did she do this? And it was because of a second aspect of her philosophy, that everybody has a unique strength, and the challenge is to find it, bring out the best in people. And that's also a very central aspect of positive psychology.
Yeah, absolutely. I love that. And it's what I keep in mind as I'm shouldering along my daughter who's 12 and becoming a teenager is what are her strengths? And so that's very wise. Yes. And how do you use these philosophies in your own life to stay happy and healthy?
Okay, so first, I like to stay active and engaged, and I try to make a healthy lifestyle fun. So, for example, I have a walking buddy, and we combine it with breakfast and a cup of coffee together. A second aspect of healthy lifestyle is that I like to go out to eat for lunch with friends. One of my friends is always giving me new advice on what to eat. So, for example, she's right now on a probiotics fermented foods kick. She introduces me to different healthy foods so I can find one that I actually like. So, for example, I never liked beets, but now she's got this type of fermented beets that actually tastes pretty good. Also, on the positive psych side, rather than on just the lifestyle side, I like to plan things to look forward to, both daily and long term. So I'll give you an example. For my mom, as I mentioned, she's 103, and she's I moved her in with me after COVID. So I have painting lessons for her, flower arranging lessons for her. So things to keep her active. And last, I just want to mention, as I mentioned before, one of the things that propelled me into positive psych is I try to see the best in people. I'm an optimist at heart, and this is very helpful if you're a psychiatrist, because if you don't believe in your patients, you're in trouble. So I help them to find their strengths and find ways to engage their strengths. So those are just some of the ways in which I incorporate it into my professional and personal life.
Yeah, wonderful. And as you know, being an advisory council member for the GPHI, we're looking to move this forward, this movement of integrating positive psychology into healthcare. And not only that, but really it's now expanding to this, actually Marty Seligman first coined the term positive health, and now it's growing and developing. But it's a new approach to healthcare and medicine. Do you have any thoughts about kind of how we can move this along, and what's the best way that we can transform healthcare with these concepts that are not commonly practiced?
Okay, so couple of things here. One is the practitioners. I think they need to save time to recharge themselves. Two of the best ways to do that are to either do a relaxation, some type of relaxation, save time for that, or time for exercise. So on the relaxation side, some of the find whatever relaxation technique that works for you. So for example, we teach people in our stress management deep breathing, progressive muscle relaxation, imagery, meditation, and we send them home with the tape so that they can then choose whatever they want to practice. There are great specific recommendations for exercise for the antidepressant effect, and exercising is the equivalent of taking an antidepressant for mild to moderate depression.
Yes. It's
5 times a week, 30 minutes at a time. Another thing, notice what makes you happy and design your life to have more of it. Now, specifically with what should we do in terms of getting it into healthcare, not just on a personal level, but on a wide scale level. I'd love to see the incorporation of routine assessment into clinical care. And that could be followed up by giving patients a suggestion list for what might help, or obviously a discussion. I'd like to see stress management incorporated into clinical care. And patients should be advised about research showing that positive psych and stress management are associated with better immune function, lower cardiovascular risk factors, happiness, and longevity. So lots of positives for them. And I would love to see it incorporated. Now, one of the ways actually that clinicians can incorporate this is asking a question like, do you have a lot of stress in your life now? And how are you coping with it? That could introduce a conversation about lifestyle and positivity suggestions. I think that works better than asking them, are you happy? Because people are not, feel defensive about saying, no, I'm not happy. But if you ask if they have stress, that's a conversation that they can have. And I think will open them up to listening in a more positive way.
Yeah. Great advice. And also actually putting out there that this is a shifted approach, that we're going to focus on some additional elements of health and well-being that maybe patients might be surprised that their doctor's asking, like, why are you asking? That's,
Right.
That's because our whole culture expects something different from healthcare.
I think that's true.
Yeah. So, and I think that many of our followers probably are aware, because we've made a big point out of it, that the VA system here in the United States with their whole health program is a major front runner that has demonstrated that this can work. And even a large health system can, at least elements of positive psychology, integrative medicine, lifestyle medicine, can really be fully harnessed. And hopefully others will follow suit. But we have a long ways to go. Yep. And along that line, what do you think is going to be our greatest challenge for transforming healthcare in this way?
Well, I think that first, the medical establishment needs to recognize the importance of positive psychology and lifestyle medicine. And they're on the road to doing that now. I think a second thing is that clinicians need to have time to discuss this with patients, which they don't really have now, because they're rushed along in terms of the number of patients they have to see. And of course, the big issue is reimbursement. So can we get reimbursement for this? Can it become a part of insurance? Can it become a part of what's reimbursed for physician time? Making it a part of standard assessment. Right now, for example, the American Heart Association took a long time to incorporate into their guidelines talking about depression. And it was only after years of finding out that depression predicted worse outcomes after heart attacks that there began to be this recognition by the professional organizations into the guidelines. And it would be nice to get positive psychology and lifestyle medicine into the guidelines for the various professional organizations. And you may know more about where the professional organizations are in that than I do, but I think that would help a lot in getting this adopted. I also think putting the right label on it is really important. And the label integrative medicine seems to work. But I think that we need to do some brainstorming on what's the best label for this to get it adopted and accepted.
Yeah, you raise a good point. A lot of our followers are from the lifestyle medicine community, which distinguishes itself from integrative medicine. There's also functional medicine. There's other fields that kind of overlap, and some are accepted in some healthcare settings more than in others. And the challenge of just, regardless of whatever setting it is, of finding the time with patients and getting reimbursed for that time to really delve into a healthy, happy lifestyle is a big one that certainly the American College of Lifestyle Medicine is working to address. And probably, again, many of our listeners are aware that the early adopters are going to be the self-insured companies as well as value-based care organizations. So a lot of these organizations that are really in charge of, and at the bottom dollar counts on them to get the outcomes the best that they possibly can. And not only will be paying attention to healthy lifestyles, but a lot of these positive psychology nuances that, again, are not considered a standard part of care, but yet we know can nudge those outcomes even more so. This is obviously a lot of what I've been thinking about, but I appreciate your sharing your thoughts. Any other tips or advice about how to either change the healthcare system, or if we can't change the healthcare system right now, what health professionals can do for nudging this along, even in their own practices?
Well, I think that the impetus has to come from a number of sources. One is from the clients themselves when they ask about it. So if the information is on the internet, YouTube's like this one, getting the information out there so that people ask their healthcare practitioners. I think the healthcare practitioners can discuss the benefits of it, maybe have an anecdote or two to tell their patients. That would be helpful. And of course, the third prong is having the, as I mentioned, having the professional organizations pushing it as well.
Yeah.
And insurance companies reimbursing for it. But anyway.
Ultimately, of course. Yes. And for listeners who are just thinking about getting involved in the movement, learning about lifestyle medicine, learning about positive psychology, integrative medicine, the link between positive psychology and health, all of that, there are a lot of resources out there. We've mentioned many through this podcast, but what are some of your favorites?
Sure. So I have a couple of favorites. One is that Martin Seligman has several books that are very easy to read and are readily available. One of them is Authentic Happiness. Another one is Flourish. Another one is Learned Optimism. I'd probably read Authentic Happiness first, and then Flourish, and then Learned Optimism, because there's a lot about optimism in his Authentic Happiness book. Second resource for lifestyle medicine is your book, which is called The Roots of Positive Change. And a third resource for stress management, I'm co-author of a stress management workbook and companion facilitator manual, which is published by Oxford University Press. So those are the first three kind of sources that I would look at.
Well, thank you for that. Any other organizational websites or other places that people can go? Sure.
So there's your organization that you were president, the Lifestyle Medicine Organization.
And the American College of Lifestyle Medicine.
American College of Lifestyle Medicine, let's get it correct. There's the International Positive Psychology Association that you and I are both active in. There's GPHI, the Global Positive Health Initiative.
Yes.
So those are the three that come to mind. Do you have any others you think we should add?
Lianov? Well, you have a lot of connections and have been a past president of a psychiatric association. And so I wonder, can you speak on that a little bit? Yeah,
sure. It's the American Psychosomatic Society, and it's really the scientific arm of mind-body medicine. We investigate positive states, negative states, and their relationship to biological measures that are important in health. So yeah, it's a great organization, and we welcome new members. I would start with just going to the website, the American Psychosomatic Society. Oh, we also have a journal, which is called Psychosomatic Medicine.
Yeah, terrific. Yeah.
Thank you for making me mention that, or for suggesting that I mention that.
Well, you've been a career-long researcher in this space. So I'm curious to know what you think is a research question or a series of research questions that, if we can answer them, investigate them properly, will really revolutionize this kind of movement of fully integrating positive psychology, lifestyle medicine into healthcare.
Okay, so my original research question, which has really guided my career, is what is the effect that your psychological well-being and psychological stress has on your health? And how does that happen? Well, it happens through two major pathways. One is the biological pathway, and one is the behavioral pathway. So lifestyle medicine is that behavioral pathway. And the biological pathway is what we look at the American Psychosomatic Society. So I think step one is to demonstrate, which I think we've really done pretty well, that psychological states do have an impact on health. And there are reviews of positive affect and survival. I've done some work in that area. There are reviews of meaning and survival. There are reviews on optimism and survival. So all of these, and I've done work in all those areas as well. So all of these,
spirituality too. You gave us a talk on that as well.
Yes, I gave you a talk on that, and while it's not my focus right now in this talk, I should really mention it, that spirituality is actually it's one of the most consistently related factors to happiness, and it also does predict survival. And if you look up my name, you'll come up with a bunch of articles. My latest one, actually, which was just accepted, is, believe it or not, the first one to show that praying predicts survival in people who have a chronic illness.
Wow.
Yep. So that's going to be published in the Journal of Religion and Health. So anyway, but the second phase of the research phase is putting what we know into interventions and showing that those interventions can impact on health. And it would be very nice to show it in both people who are initially well and people who are initially ill. And there are many studies, well, I shouldn't say many, there are several studies that are doing these randomized controlled trials right now. The names of people who are doing them that come to mind, if you want to find them, are Judy Moskowitz and Jeff Huffman, both terrific researchers. And so you can find out the latest on those. I think that once those intervention studies are published and show an impact, then it might have a greater acceptance in the medical community.
Yeah, thank you. Thank you for that, Gail. And I've been in the last few months culling through that literature. And yes, the names of Moskowitz and Huffman come up often, and many other wonderful researchers that are connecting a bunch of positive psychology constructs with various diseases. Top of them, the one most studied is cardiovascular disease, but diabetes and others, asthma, arthritis. And I've been culling all that literature as we're preparing to pull together a book called Lifestyle Medicine from the Inside Out that will expose how important this connection of positive psychology and health and
that's great, and
outcomes.
And Jeff Huffman is the person for the cardiovascular. Jeff Huffman and Chris Milano, they've collaborated together. They're at Harvard, and they're doing the intervention studies in cardiac patients. So yes, and there's actually a long history of addressing the negative side, that interventions to change type A behavior, and interventions, post MI to improve on lifestyle. On lifestyle issues. So this is, I think, a very necessary and important direction of research that needs to be carried forward.
Yeah, thank you for that. Well, as we wrap up this brief podcast, Do you have any words of wisdom, like the one takeaway for our listeners?
Okay, so the one takeaway I would say is carve out protected time for renewal, exercise, be social, and eat healthy food. These are the 4 things that will help energize you. The 5th one, I would say, notice what you say to yourself. Be the encouraging coach to yourself. Now, you did ask me one thing in closing. That I have one other thing to share, which is that Dr. Seligman has a mnemonic or catchword for positive psychology. It's PERMA. It stands for positive emotion, engagement, relationships, meaning, and achievements. I would like to add to that optimism, relaxation, and spirituality to his mnemonic. That makes it PERMOSA, PERRMOSSA. So if you want to have a simple mnemonic to remember all this, that's what I would do. That's what I would have in your mind.
Well, everyone who has been in the positive psychology space knows of PERMA, but this is wonderful. We have a new mnemonic. Love it. Thank you, Gail. And thank you for joining us for this GPHI podcast. Thank you for serving on our council and for everything that you do. And thank you to our listeners for following us. Please subscribe to our channel. And we hope to see you on another one of these wonderful interviews. And in the meantime, be safe, well, happy, and healthy and successful. Take care, everybody.